Welcome everybody to the U.S. Reps webinar on current best practices for the prevention of death and catastrophic injuries in athletics. We're presenting this in collaboration with the U.S. Council on Athlete Health. In this session, we're going to explore the inter-association recommendations for preventing catastrophic injuries and death in collegiate athletes and the movement towards an athlete-centered care model. Our STEAM panel will discuss the consequences of staff non-compliance and how U.S. Reps and USCA can assist universities in maintaining compliance. To make sure that you can review this valuable content, a recording of this webinar will be sent to all registrants by email. If you have any questions, please use the Q&A button on the bottom of the screen, and we'll address those in the final 15 minutes of the webinar. And this is really your opportunity to engage with our panelists and seek any clarification that we have on the topics we discussed today. Without further delay, we're going to get started. Let's do a brief introduction of who we are. My name is Francis Neric. I'll be facilitating, today's call. I am the current president of the Coalition for the Registration of Exercise Professionals, sometimes is known as U.S. Reps. In my day job, I am the Associate Vice President of Certification and Credentialing at the American College of Sports Medicine. I'll hand it over to Brian.
Hi, everyone. Brian Biagioli here. I am the Graduate Program Director for Applied Physiology at the University of Miami. I'm also the Executive Director for the Board of Certification, representing one of the strength coach certifications here for the National Council on Strength and Fitness, and I'm currently the Vice President of CREP. Bob, I'll hand it to you.
Bob, you're muted.
Good afternoon, everybody. My name is Bob Sweeney. I'm an athletic trainer and senior vice president here at the U.S. Council for Athletes Health. Most of my experience has been with sports medicine and athletic training at the intercollegiate level, and I currently work at USCA supporting our intercollegiate clients and partners.
Borchers.
Hi, good afternoon, everyone. My name is Jim Borchers. I'm the president and CEO and co-founder of the U.S. Council for Athletes Health, and also the chief medical officer for the Big Ten Conference. I've been involved for the last 25 years in athletic medicine, and really excited to be here today to share some time with all of you, but also with these panelists. And I think I'll pass it over to Shelby.
Hi, everyone. My name is Shelby Williamson. I work for the National Strength and Conditioning Association, and I'm our representative on the board for U.S. Reps, and I also serve as the secretary.
Awesome. So let's get started. Dr. Borchers and Brian, I'd love to be able to ask you this question. I'll leave it to the two of you how you want to answer it on this kind of open discussion. How did the inter-association recommendations to prevent catastrophic injuries and death in collegiate athletes, how did that happen? So I'm not sure who wants to start first.
Well, Jim, why don't you take it from the 2012 original recommendations on death and catastrophic injury, and then I'll follow up with the development of the secondary components.
Yeah, thanks, Brian. So I think that everyone understands that there's been significant issues in the last 20 plus years around the issues of catastrophic injury and sudden death in athletes, especially at the collegiate level. And unfortunately, as it, as we think about issues that happen outside of sport, oftentimes thought about as those kind of conditioning activities and activities that occur that are preparing athletes for sport. I think we're all reminded even today, 5 years ago, almost to the day of Jordan McNair at Maryland and the tragedy that occurred there, to remind us about why these inter-association recommendations were put in place and guidelines were put in place. It was really an effort by the NCAA and other supporting organizations, including this organization, and just about every major sports medicine organization in the United States, to set guidelines on 6 different pillars for issues that needed to be addressed around the prevention of catastrophic injury and sudden death in sport: sportsmanship, protective equipment, acclimatization and conditioning, emergency preparedness, the duties of athletics personnel, and then education and training that's required on an annual basis for individuals that are going to interact with athletes. And these recommendations have been certainly highlighted by the NCAA They're required by all institutions at all three levels, and have really set the standard and the playbook around risk and liability when it comes to these issues. And so as history has evolved, I certainly know COVID, the pandemic really put, this kind of to the back burner, but it is streaming towards the front. And certainly along with emergency preparedness issues has been a topic of discussion. And Brian, I think that hopefully leads nicely into the secondary recommendations that you wanted to discuss.
Yeah, I just want to emphasize with some numbers, because I went to the National Center for Catastrophic Sport Injury reports, and I did a little bit of math, and since those recommendations in 2012, which I was actually a participant in the study components of that recommendations, there were 771 deaths that occurred at high school and collegiate levels within sports. Now, not every single one of them was exertional specifically, but a high number nonetheless have been attributed to those exertional-based practices. So jump forward to 2019, where we saw a secondary group of recommendations that were done for strength and conditioning coaches specific to the transition back to sports, and those concerns also around that rapid COVID transition. And between 2019 and 2021, there was another 126 deaths. So even though that we have these reports going on and identifying the problem, we also have the recommendations that are the solutions to the problems. The one thing that seems to be consistent is while the recommendations are consistently appropriate, the actual inconsistency comes with the professional who is delivering them. And so I look back just at football in the prior to COVID. We did an analysis to see, okay, well, we saw that there were exertional deaths associated with, I believe it was 32 different players, and we looked up the credentialing and qualification of the individuals who were in charge of those practices, and not one was appropriately qualified by the distinction of the current recommendations. And so fast forward to now, the 7 recommendations were based on all of these considerations. And so when we look at it, we say, all right, is the professional appropriately qualified to even manage the situation? Do they have the requisite education and training through internship experiences and related guidance towards their professional capabilities? And then we also take a look at, is there oversight associated with these practices to ensure that, one, the practices are most appropriate, specific to the age of the athlete and their condition and the transitional period of time, but also is their autonomy and support mechanisms to ensure that they're not being influenced by a sports coach, for instance, and that they are being held accountable for continued education and practices and emergency management and different components like that. And those of you that are familiar with some of the most modern occurrences, is we have seen 3 recent deaths that were associated with just the mismanagement of the situation. So I think that there's a lot of evidence and support for the actual recommendations, the way that they have been written. And just to kind of put it in perspective, following the whole research study, it was released on the recommendations before for stakeholder feedback, and there was a 90+% support for every single recommendation. So there's been a lot of consistency since 2012 to 2019 to these current recommendations, and I think now it's just time that we get a bunch of people behind it. The additional comment that I will make is these recommendations were circulated amongst the 11 leading organizations related to collegiate sports, and every single one of those organizations endorsed it.
That's great. So Shelby, I guess it's like the one question I have for you. Which NCAA divisions are affected by these changes? Shelby might have, I know she's going through a weather storm in Colorado Springs. I'll give her a second answer. If not, I'll hand it over to Jim. Jim, if you want to address it.
Yeah, sure. So as I just mentioned, all 3 divisions in the NCAA are affected by these recommendations. The NCAA has stated a number of times that all institutions in all 3 divisions are required to meet the requirements laid out in the inter-association recommendations. The Board of Governors bypass normal legislative process in the NCAA to make these association-wide policy. And the expectation is that institutions and their practitioners there will meet those recommendations as was mentioned. And I think most importantly, that the attestation of meeting those recommendations is something that's going to be required, and certainly required at the Division I level, and anticipated even at Division II and Division III level, in order to ensure these requirements. So all that to say is that certainly this is becoming best practice. It's becoming standard of care, and it's certainly required at all 3 divisions in the NCAA. And sorry, I didn't mean to cut off Shelby if she was there, but
you're okay. I'm having connection issues, so I apologize, everyone. But yeah, just to echo what Jim said, it's going to be required by all divisions, any school associated with the NCAA. And that means all athletic personnel who play a role in the prevention of death and catastrophic injury for your student athletes. So the expectation is that you're aware of these recommendations, you understand them, and you understand your university's corresponding policies that they have set in place to adhere to them. So sport coaches and staff, sports medicine, strength and conditioning, anyone who's involved with the student athlete.
So I guess I can ask to do a quick follow-up. Is just, I guess, to Brian and to Shelby. How have your organizations really pushed that message out to your strength and conditioning coaches that this requirement is coming? How have you communicated that as your individual organizations?
Shelby, you can start with that, and then I'm going to follow up with also some additional information.
Yeah, I think for us, since we primarily certify strength and conditioning professionals, just making sure they know that this is coming down the pipeline and that the registry supports them and that they're in this registry as long as they stay up with their certification, but that they're a part of this cycle with the student athletes and the prevention of death and injury, and that they're aware of it and working with their sports med staff or coaches and sport coaches so that they're adhering to the education requirements that they're expected to follow now.
Yeah, and I'm going to hop on top of that commentary and suggest that the respective organizations that have the NCCA accredited certification for strength and conditioning coaches are sending out detailed information regarding the requirements, 1, to maintain your certification in good standing so that you are on the registration system, and 2, the continued education requirements that will be associated with the recommendations is readily available and at limited resources to the individual or the universities who are supporting them. So the one thing I would do as a quick plug for both the register and as well the information that we're talking about is if you go to usreps.org, you'll find that right on the homepage, there are the current best practices listed, and that is for not only the athletic departments, but also for specifically the strength and conditioning coaches and what their requirements will be. The second part is if you are a certified strength and conditioning professional in good standing, you'll be able to click on the registry and look yourself up. And that will be available also to anybody for credential verification at any time. So it alleviates some of the challenges that we've seen with human resources in identifying who is currently valid and who is not. The other thing that I would suggest is making sure that you know when your expiration date is, because if at any time the certification lapses, you'll immediately fall off the registration system. So it's important to stay in good standing.
I think the next question I have for you, Brian, and I think Jim brought it up, we're talking about education, certification, and then continuing competence standards. I think we talked about that. Can you explore what those things mean? I think it just be helpful for people to understand, how those are, what those individual components are and how they're complementary to each other. Can you explain that a little bit?
Sure. One of the first things you have to do is take a look at who is the stakeholder that we are discussing. So for instance, if you go to a college, your education will be accredited, and that education accreditation is so that you as the stakeholder, being the student, can be assured that what you are learning is appropriate and in line with the professional outcomes. When we look at it from a credentialing perspective, there's actually a role delineation study that's done to identify all the tasks, knowledge, and skills that are required to actually perform the job at a reasonable level, meaning safe and effectively. A role delineation study analyzes all those different aspects, and the testing that is done to make an accredited certification exam is specific in protecting a different stakeholder from the examinee. It's actually protecting the public, in this case, the student athlete. So if a certified strength and conditioning professional is certified through one of the NCCA accredited programs that's on the registry, we are assuring a minimum competency that they can do their job safely and effectively. The education and preparation for that, the curricular components actually come from the role delineation so that we know what should be taught in the class. So the Committee on Accreditation for Exercise Sciences, for instance, or CASCI would analyze, does the curriculum match up with the task, knowledge, and skills required for the certification? So essentially, education should be a board preparation. Within that, there are different domains of education. So, for instance, there might be something that is more specific to functional anatomy and physiology. Well, when we look at the continued education components, they have to align with those domains. So, to Jim's point, if a person has a particular qualification, let's say a degree, that is for the life of the individual, whereas when we have a certification or continued education components, that information has a particular period of time where it is valid. And so we need to have ongoing continued education, particularly in the areas of sensitivity around death and catastrophic injury. And so within the time frame of recertification, we're also going to have expectations that the continued education with each of those domains is met.
I think that we're trying to simplify it. I think it's the formal education you get is how did you adequately prepare at your particular exercise science program to be a strength coach for the education. Certification is the independent assessment of competency, regardless of where you graduated from. You're independently verified that you're competent. And then the third part of continuing education component is really like, it's the how do you ensure that those professionals remain competent through their working career? And so that's really opportunities to tie those pieces together. How does that really affect, I guess, registration, Brian? When we talk about registration, there's like, I think there's, when we think about registration in professions, there are ones that are for different licensed professionals, et cetera. Like what is registration? How does that work? And how does it tie in to, I guess, to this industry?
Well, it's a very good point. So if you look at like the Commission on Dietetic Registration for those that are working in the nutritional fields, and there's 46 different states that have some sort of regulatory process associated with it through licensure, but not every state uses licensure. So essentially what the registration system does is it identifies individuals in real time who meet the qualification requirements to do a particular job. And so regardless of what certification you have within this particular industry, currently there are 3 different certifications that are valid for the NCAA. You would go to the registry and identify specifically that the individual that is working for you who is in application for work for you meets those qualification requirements. And so by utilizing the registration system rather than an independent verification system, you have assurance that there's consistency. You also have a reliable verification system that can be used that's consistent with other allied health fields.
Great. So I guess this question is going to go to Bob. I think we're just going to change gears a little bit here. And here, when I work at the American College of Sports Medicine, we always hear about things like client-centered care. In the healthcare model, this is where the healthcare team considers the client's unique needs, their preferences, their values, in all of its decision-making and care planning. So working together as a team in order to really support the patient. So when we're thinking about the interassociation recommendations, is this moving toward an athlete-centered care model? And kind of, I wanted to have you explore that a little bit.
You know, Francis, that's it exactly. It does come to, this concept comes to us from the healthcare world, and it, you know, I mean, replace patient with student athlete, putting them at the center, you know, for their health, safety, well-being, and performance. And it really, you know, we see a lot of schools do this organically and have been for a long time, but a lot of institutions are becoming much more intentional about it, creating that regular cadence between the sports medicine and sports performance areas, adding in nutrition and sports psychology when necessary and when available. And again, having that conversation and sharing of best practices between the two areas, and whether it's planning workouts, and coverage of those workouts, or even, the individual performance of a student athlete, it makes it a lot easier to provide that individualized look at one of your athletes, even on large roster teams, but the key is, again, to be intentional about it, to create those regular communication points or meetings to have that. And really, there's no extra resources except for time that are needed to have this kind of interaction. And we've seen folks have a ton of success with it. And it really helps, break down silos and some of those things that may hopefully don't, but may exist. So it's been a great concept, and we've seen schools of all levels employ it and really have a lot of success.
I think that's really helpful to show that the strength conditioning coach they're uniquely qualified, right, through their education, training, experience as part of the team. And so being able to kind of connect the pieces together. And I guess I'm going to ask this question to Jim. Can you discuss like standard of care? I guess in the backdrop in my mind is thinking about Maryland. If you're wanting to kind of discuss that, so I'll hand that over to Dr. Borchers.
Yeah, I think it's a really good point, Francis. I think we have to all recognize that, a lot of people talk about enforcement, and I think what is best practice and standard of care, and how does that get enforced? It usually gets enforced, either through, an organization, or it gets enforced through public opinion and what standard of care looks like and what those procedures are. And I think that we all have to recognize that standard of care is extremely important when you think about the duty owed to special populations. And we've seen that throughout, medical issues, and certainly throughout athletics. But I think when you think about athletes in general, they are a special population, and the duty of care owed to them is specific. I think there's some things from the inter-association recommendations that are really important to point out. Number one is that any individual conducting any sort of workout or athletic activity with another individual is responsible for any emergency that could occur during that activity, regardless if a medical person is available or not during that activity. And I think that's one of the things that we've seen, is that the term deliberate indifference gets used a lot, like, well, I'm not responsible because an athletic trainer is present, and so they're responsible. And the reality is that that's not the case. Standard of care is that the individual conducting the activity is responsible. They're responsible for making certain that they do everything to prevent catastrophic injury and sudden death in athletes, and that if there is an emergency that occurs, that they're able to respond, whether or not there are medical professionals there. And I think that's just one example of thinking about, it's not that an athletic trainer is a safeguard for inappropriate behaviors or inability to respond. It's that everyone is responsible. And that has been shown out very significantly in the courts when it comes to liability and when it comes to decisions that have been made. And so I think it's really important to understand what that standard of care is, what these recommendations suggest, and what your individual motivation should be to meet those. And I think that's the thing that is so exciting about this opportunity, is that we know, as Brian mentioned, there's so many individuals that want to be able to express to their constituents that they're meeting best practice, they're meeting standard of care, they're doing the things that should be done when you're a professional and you're in this space. And this is a great way to be able to illustrate that, and a great way to be able to direct individuals to a place to be able to illustrate that as well.
I guess this question I'm asking to Brian, what happens when staff come out of compliance? And what I mean by out of compliance to those seven recommendations that were there, like expired certifications or lack of documentation of athlete safety and training. What happens when a program, their staff comes out of compliance? What happens?
It's easy to look at this from the same perspective as your driver's license. If your driver's license is expired and you get pulled over, you are not a licensed driver. So a certification, and as I mentioned before, the continued education in particular areas is perishable. So therefore, if you were certified at one point but did not do any continued education to recertify or retest to meet those qualification standards, you would essentially not meet the qualification requirements. It's just like if Dr. Borchers lost his medical license because he decided not to do the continued education and training that was required to maintain it. And so if he practices medicine beyond that point, he's actually breaking the law. Now, while there's no specific laws that exist here, there is going to be ethical laws, and those things are going to be supported by the sanctions that are quite capable at the different levels that Dr. Borchers talked about before. The important aspect of it is when you are functioning as a true professional, the maintenance of qualification is going to be something that that you're going to do as part of your best practices anyway. And so engaging in these recommendations makes it even easier in the fact that you basically have a path to follow and just meet these things with a level of consistent basis, and there won't be any issues whatsoever. I think it's important to recognize that when we did the actual initial surveys, particularly the professional strength and conditioning coaches at the collegiate and professional levels, we found that there was already 85% compliance at the minimum levels. And the other thing that's important to understand that this is kind of a sunrise expectation. When you go and you look at the recommendations, while there's 7 different recommendations, the expectation is that you don't meet them all today, but that you are on the path to meet them. The first thing that everyone is going to have to do, obviously, is meet that certification standard. And then what we'll look at is the continued education requirements to maintain that standard. And then, of course, we'll look at the additional components as we raise the bar for student athlete safety.
So I guess to the USCA team, when we're thinking about like mitigating risk or kind of in insurance and lawsuits, can you talk that through a little bit of like, you know, with the universities and kind of like how is this the recommendations really kind of helping them manage their risk?
Francis, I would say that the recommendations really provide a roadmap, a checklist, if you will, on how to, you know, get into alignment with these with these best practices and you know, recommendations that we have seen become requirements. Here at USCA, we've, worked diligently over the years to, stay up to date on these and hopefully create, create tools that help athletic departments, sports performance professionals and athletic trainers, be able to do that and be able to demonstrate that they've done that. So, the document, both documents, the prevention of catastrophic injury and death document, and then the, partner document, around transition periods really provide 2 good roadmaps for, maintaining alignment with these recommendations at the institutional level.
Yeah, and I would say, Francis, just to again reiterate that institutional liability and risk is something that is definitely called out in the new NCAA Constitution, and mitigating that risk through the education and compliance of staff is part of that. I think as well that institutions are going to be looking more stringently at whether or not individuals are meeting their professional requirements when it comes to these issues, and I think we're going to see that continue to get more impactful as we look at how college athletics continues to evolve and this metamorphosis occurs. I also think that when we talk about risk and liability, it's extremely important that individuals are able to demonstrate to their employer and to their constituents their professional development in this area and ability to be in alignment with these types of recommendations, because look, it just is going to be something that makes sense, and to be proactive about it makes a lot more sense than being reactive or trying to figure out exactly what that means, if it comes from an employer.
What do you, when we talk about lawsuits, like how big of these lawsuits are we talking about? I guess that's Jim, like you've been tracking those. I think this helps people kind of quantify what we mean by that.
Yeah, very significant. I mean, you're talking about, 8-figure lawsuits. You're talking about, millions and millions of dollars that are being awarded in judgments and other suits that are being settled. around the inability to maintain, appropriate standards when it comes to these type of events. And I think that the other thing that is maybe the secondary, and Brian can probably speak to this, probably the secondary to the monetary issue is the loss of someone's career, and the inability then to function in a profession that you've trained a long time for, and that you've been, that you've really maybe spent your life, dedicated to. But we do see that. We see it in other professions, and by ignoring these types of responsibilities, you can put your career at risk unnecessarily, in my opinion. And I think that's the secondary tragedy of these types of issues, is that need to be aware of the entire spectrum of what needs to be accomplished. And look, we're not talking about months of study, or we're talking about revisiting familiar concepts on an annual basis to make certain that that you're up to date with any changes that have occurred, or things that you should stay up to date with. So I think it's imperative upon individuals and their associations and governing bodies to make certain that they have adequate ways to do that.
Great. So I guess the question I'm going to ask to Shelby, when we're thinking about how the U.S. registry kind of helps in kind of mitigating that risk, and when we're thinking about kind of the registry, athletic directors or kind of like head strength coaches, they have to manage all these folks, and how can they use the registry to kind of help with their ability to kind of manage, making sure that they're kind of up to date?
Yeah, so the registry allows universities to have like a centralized location to look up and see real time if their staff members are in compliance, if they haven't let their certification lapse, as long as if they have an active NCCA accredited strength and conditioning certification that's provided by one of the organizations associated with US reps. So if their staff member is not located on the registry, whether because they let their certification expired, or their certifications through another organization that's not associated with US reps, then the university has to identify if they need to address this, if they need to make necessary changes, or if they need to verify their credential through other means. So the registry provides more ease for these universities to confirm if their staff is in compliance, and if they're not, then they're going to have to take extra steps to make sure.
Awesome. So I guess I'm gonna ask a little bit more of the question to Yuska. And when we think about the strength conditioning, one of the recommendations that they need to have is on health, the athlete safety requirements, the training of that. Can you explore what we mean by that? I guess ask it to Bob.
Yeah, really, and again, it's spelled out pretty well in the document, but it's really taking some of the individual topics, whether it's heat illness, rhabdomyolysis, overtrainings, all these individual topics, and as Jim said earlier, just having some annual education that you're able to complete and able to demonstrate that you've completed it, and that's one way to maintain the compliance. Adding to that, making sure that your institutional policies and procedures that you and your sports medicine partners at your school work under are aligned in best practice and up to date is another very important aspect of this. And then finally, just having your workouts designed properly and the coverage for those workouts, but also the training for people supervising those workouts if and when medical is not available is also another very important part. So having your emergency action plans up to date is another very important aspect of all of this.
Yeah, Francis.
After that.
Yeah, I would just say that Bob makes a really good point about some of the minimum standards. I think just again, some of the topics that need to be covered, the foundational elements of an emergency action plan, and certainly what goes into an emergency action plan and your responsibilities, head and neck injuries, cardiac events, exercise associated collapse associated with sickle cell trait, periodization and training principles. So things that are already part of strength and conditioning world, but also are really important of understanding with the emphasis on transition periods, asthma, rhabdomyolysis, recognizing diabetic emergency, exertional heat illness and heat stroke. So these are the types of issues that everyone needs to be aware of and on an annual basis. And again, I would suggest that this is not new to this field. This is something that has been there, as Brian has mentioned, for some time. And now the focus is shifted to that, and the focus, especially as Bob mentioned, with emergency preparedness and recognizing these events. It's not just enough to have been trained on how to use equipment, for example. I think it's AEDs and those things that are ultimately extremely important, but there's another step. There's the ability to recognize, and when you can recognize, you can react. If you can't recognize, you can't react, right? And so and you can't react appropriately, and we want to make certain that that's the case. That's what these recommendations are there to do, and revisiting that information is a great way to make certain that you're professionally staying up to date to be able to do that.
And I think it's just like it's the perishable skills. I think that Brian, I think we've talked about in the past. And I think there's when we think about continuing competence, and I think a lot of folks don't think about that, right? So when we think of, oh, I went to college or university, an exercise science grad, right? That gives you a foundational knowledge. But you think about your undergrad program, like, I don't know, a comparative literature class, no one's going to ever ask you again after you graduate, how would you do this in a comparative literature class? Because those are skills that you've learned in the past. But the point is, when you're doing continuing education or continuing competence, like, how do you maintain that competence as you're actively there? Like, what are those skills that you need to demonstrate on a regular basis that you may forget if you don't practice it? And I remember when I used to run an aquatic program and lifeguards, we would always do in-service training, emergency action plans. We'd know where the backboard is. We would do the calls. We would practice regularly over and over and over again. For one is recognizing an emergency is happening, and two, how do you work effectively as a team to get that person help as quickly as possible, and then coordinating that with emergency procedures. Having kind of like the training, I think is on one hand is great, but like, how do you do this on an ongoing and regular basis is another, really keeping up with it. Brian, I'm sorry I couldn't go on.
Yeah, I just had a couple of things to say that I think is important for the audience to recognize. The first part is there has already been defenses by professionals who said, okay, a situation happened, that's not my role, so I'm not responsible. Well, the fact of the matter is that defense did not hold up in any case. So you can't use that particular component and try to blame it on the situation. The second thing that I would add is looking at the difficulty in actually killing a healthy 20-year-old athlete through exertion is you really have to push them to the edge, right? So since 2012, we have had close to 800 different deaths. So they're going to occur at some level. And all we're asking people to do within this profession is to be prepared and to have your professional capabilities ready to manage the situations that we have identified. And so we're leading everyone in the direction of best practices for the stakeholders, which would be the student athletes. So even though you get hired as a strength and conditioning coach and you yourself might feel the stakeholder of that job, the reality is your job is to protect and support the athletes. And so as soon as people recognize who the stakeholder is, then we can work in the direction to support that stakeholder. And that's what these different continuing education recommendations are for.
Awesome. Let's go. I think we have another couple more minutes, but I think that's in terms of we're getting to the Q&A section. I know that there's a couple questions that came in. I'm going to open it up for those questions and answers if we're okay with that. I think one of them came in from John. Can there be a link provided to the information for the upcoming strength coach education and upcoming criteria that was mentioned? Absolutely. You can find those on usreps.org. The compliance document for the interassociate recommendations are on there. I believe we'll put that in the chat so you can see that. And then another question that came in is there an updated list for the leading organization, the 11 leading organizations of collegiate sports? I think, Jim, you answered that a little bit, but did you want to explain who those those organizations are, I think that would be really helpful to kind of and how they are connected to the recommendations.
Yeah, I think that, the most important thing about the organizations is that it was really an effort to make certain that there was, as Brian mentioned, consistency. So you're talking about the American Medical Society for Sports Medicine, the American Orthopedic Society for Sports Medicine, the National Athletic Trainers Association. You're talking about, obviously, US Reps and C Reps, the Collegiate Strength and Conditioning Coaches Association, the College Athletic Trainer Society, the Corey Stringer Institute, which speaks a lot, to health and safety for athletes. The National Strength and Conditioning Association, which Shelby represents, that's here today, is part of that. NOCSE, which is the National Operating Committee for Standards on Athletic Equipment, which standardizes athletic equipment, and the Sports Neuropsychological Society, along with the American Association of Neurological Surgeons. And I think what you find is when these endorsing organizations, Francis, when they endorse these types of recommendations, what happens is that they get built into the literature across a number of different specialties as best practice. And I think that recognition is really important. It's important to recognize that if and when something does happen, that's what we're going to be pointed to, is these organizations, to Brian's point earlier, and to what I just mentioned, have all endorsed these recommendations. And so just as someone may say, well, is this meant to be, the definitive, guideline towards this? I don't know that anything's ever definitive, but this is certainly very well represented by the organizations and endorsed by those organizations, which creates a standard that we need to pay attention to. I also want to say again that we know that when these recommendations are followed, although we have a lot of cases that Brian mentioned, since 2012, there's been a lot of other good outcomes as well by individuals that are trained appropriately and that are trained to recognize and react. And I think that is extremely important. Again, my opinion is that I think professionals want this. I think they want to be able to demonstrate it. I think they want to be able to demonstrate it annually. I think they want to be held out as professionals. And I think it's a great step forward that being able to point to the U.S. Registry is a place where you can identify yourself as a professional in good standing when it comes to this training.
Awesome. So, and the question that just came in, I think this is kind of like a charge, I guess, to U.S. reps and USCO, but I think it's just an opportunity, but it's certainly an opportunity for us. Would it be possible to at least start the conversation or try to coordinate a webinar like this for undergraduate students in exercise science and kinesiology? This is fantastic. But the theme of kind of like how we're describing things are with the current professionals with some background information. I think that's, and really kind of the point was thinking about things you should know for students who they don't know. I think that's huge. I think when we're thinking about you're entering this profession, I think you always see kind of like, I don't know, when I think of like the Nike commercials or Reebok commercials where you see people lifting up heavy things and putting them down, and kind of the excitement of working in athletics, but it really doesn't describe to kind of aspiring or rising professionals the responsibility that you have in doing that. And I think that's when we're comparing like apples to apples of like when you're thinking about nursing, or you think about athletic training, or you're thinking about going to establish adjacent health occupations. It's tying all those pieces together. Like, yes, you need to have the background. Yes, you need experience, and it really has an ability to kind of, how do you leverage all those pieces together to show that these people are competent to do their job? So I don't know, Brian, if you want to expand on that and what your thoughts are.
Yeah, it's the, this is really an important kickoff webinar to get the word out so that people have a better understanding of why things are what they are and what they need to do. As a college professor, I would say that it's my responsibility to educate my students in the best paths to the professions that they are pursuing. What we're looking for really are champions, leadership in strength and conditioning to make sure that the head coaches is following the best practices all the way down through internships. We're looking for academic preparation and university schools to have professors that are knowledgeable about the registration system, are knowledgeable about what the requirements are in preparation for certification, and are knowledgeable on the different opportunities and expectations once a person gets a job. So really, it's a top-down approach. You know, we have the endorsements, as was mentioned by Jim a minute ago, from the leading organizations. And I actually was on Capitol Hill, and I saw the same thing when they were releasing the physical activity guidelines. And a person asked, well, okay, how are these going to be disseminated? And the admiral said, well, it's going to be on the website. So the website's not enough. We need people who are informed relative to what's on the website to be disseminating this down to the individuals who are in the trenches. And so, you know, there is an expectation that you are going to be in compliance from a liability perspective, but there's also an expectation that people who are developing or up and coming strength conditioning professionals from an academic and internship perspective to be conveying what's important for them to be the next leaders in the strength and conditioning role.
Absolutely. And again, I think for our attendees, make sure you're using the question and answer. And so this is your opportunity to ask questions to our panelists. And I guess another question for you all is just like how, and this is more of an open, and I'll leave it to you all to who wants to answer this. How have the supporting organizations and USCIS partnered to allow individuals to meet the annual requirements to be in good standing? So I guess it's going to open up to all of you. How have you worked together in order to do that?
Well, I'll hop in and start, and then I think Bob or Jim can convey, and Shelby feel ready to chime in. What's interesting about the United States Register of Exercise Professionals is when you look at it, you have different choices in which organization that you're going to participate in. That being said, while the certifications have a consistency and have been mapped actually at the international third-party level with almost a 97% overlap. So there's consistency in the qualification expectations. There's also consistency in the expectations of continued education. And we have already gone through and reviewed, particularly continued education from the United States Council on Athletes' Health, so that everyone has the ability to meet the requirements today. Everyone has the ability to meet the requirements with limited resources, and all the respective organizations, inclusive of the CSCCA, who's not here today, have already approved this. So we have all of the, all the boxes there for you, and the checks are also supported by the respective organizations.
This question just came in, and this is a great question, is how do these recommendations affect the private sector? This is a great question. I think when we think of US reps and kind of the breadth of the organization, the outreach and advocacy work that we do, I think on one hand, the part that we're trying to really push is to position those exercise professionals as part of our mission, as part of it. Not only they're uniquely qualified to really that they're uniquely qualified through the education and training, but really it's just being able to go after, are there opportunities for reimbursement, right? So I think from a reimbursement model, when we're thinking about like somebody who finishes cardiac rehab or pulmonary rehab, how do you get that referral from the physicians to the appropriately qualified person? And that's really kind of the same sort of scaffolding that we saw with the NCAA, with education, certification, continuing competence standards, registration, all those things. Building on top of that, I think that's really kind of be a big thing as we start chasing kind of opportunities to be a part of healthcare and be able to work in unison. I don't know, Brian, what are your thoughts on kind of on that?
So let's do a historical perspective on where we got, how we got here. Besides the information that I provided related to recommendations that were being developed because of what was happening to the student athletes, we were approached by the NCAA specifically in 2017 to unify the qualifications and support mechanisms so that there was a clearinghouse for these different universities to identify who was qualified and in good standing. So full stop there. That is the first time that we have seen kind of a regulatory response relative to the management of the qualifications and workforce development within the athletic spectrum. That being said, there's always a trickle down. So when we are supporting high levels of student athlete wellness and safety at the collegiate level, there's going to be an expectations at the high school level as well. And so while sometimes, high school strength and conditioning isn't looked at the same levels as the strength and conditioning at the collegiate level or at the pro level, I would argue that's one of the most important areas, particularly as it relates to development and requires high levels of competency. And so what I think you're going to see, Francis, is one, because of what's going on with the National Exercise Referral Framework and association with healthcare, I think you're going to see a continued expectation of support of all stakeholders that fall under the register. And obviously, because we have so much support and backing with these initial recommendations, that they will bleed into the other areas that also have the expectations of support of the stakeholders.
I want to come back to the high school component. I'm going to pause there. I want to come back to that, but Jim, I know that you'd like to kind of address this as well. So I'll come back to the high school component.
Yeah, I just think real quickly, Francis, that, you talk about standard of care and best practice. And I think it's important to note that for any individual who's going to conduct exercise training with another individual, and I think it obviously gets heightened and certainly the awareness is there at the collegiate level, you should be ready to respond to an emergency. And you should be ready to consider how you would respond should something happen, whether that's in an individual training session or whether that's in a collegiate setting or high school setting, a private personal setting. And I think when we talked about standard of care, the public has an expectation that that is what will happen. And so if I was an individual and I was going to hold myself out there in the public as a professional in this area, I would be completing this training and I'd be illustrating it to my constituents, regardless of what level that training was at. I think this is just good practice for the individual. And I do agree with Brian. I think you're going to continue to see this be emphasized at all levels of athletics and even in the private sector. And the courts have made that very clear as well. They've held coaches, sport coaches, those coaches that are conducting conditioning activities, they're holding them accountable to these requirements. And I think that to ignore that is wrought with problems. But I think that any individual who's going to be involved here wants to demonstrate that through this professional development. And I think we've obviously worked hard with those organizations to develop ways to do that. And I think Brian's point about that being available now is really important. So I hope that individuals will take this opportunity to act.
I think I think I want to bring Shelby into this conversation because as a D1 athlete and then kind of an Olympic hopeful in bobsled, I mean, for you as an athlete, I mean, you're uniquely positioned because you went through school for exercise science and you're a strength conditioning coach. But I guess it's like talk to me about it as the recipient of strength and conditioning practice. I know you and your sister were kind of like we're both athletes. Can you talk to me of what that means to you then as the athlete, as you're preparing to really for peak conditioning, and what your expectations were as an athlete kind of going through this?
Yeah, I mean, I'll put my athlete hat on now. The expectation for me was to have like a strength and conditioning professional or exercise professional working with me that would prevent me from getting injured so I could compete at the highest level, like through my entire career and not deal with any issues. And for me, I started lifting and doing strength and conditioning when I was in high school, like pretty young. I think a lot of people don't get introduced to it until they're in college. And that had a huge impact on like the longevity of my career and not having any like serious injuries. Is that kind of what you're asking?
Yeah, absolutely.
And having someone who's like, I was super fortunate, and I was obviously at a big school where I had these amazing professionals who were incredibly qualified. And there was that level of support and those resources, but for schools that don't have it, to seek out individuals that are qualified, and kind of do your own research. But the registry is a great place for you to look for those individuals in your area if you are a high school athlete or someone who's looking to compete at the next level.
And Francis, let me add on to that real quick. And the reason being is we actually interviewed some of the individuals who were injured and were involved in the lawsuits. And there were two things that were consistent from each of the individuals that we interviewed. One was they thought that the individual was highly qualified just based on the position that they were in, and we're going to listen to every single thing that they said. And the second part is they were extremely let down in the fact that the institution did not protect them appropriately. And so, you know, on the one case, you know, there's parents out there, there's athletes out there that just assume based on a person's title that they have these competencies and don't really look into where the qualifications come from and some of the supporting evidence that would underpin that qualification. And then two, it's important that they understand that there's a fiduciary care model in association with being a coach, being a strength coach, and even being an athletic director who is the person who hires them. So there's responsibility that crosses all of these areas. And again, the stakeholder in this case would have been Shelby. And so she got lucky. Actually, I'm laughing to myself a little bit in the fact that, you know, she was actually going through strength and conditioning that worked, right? It did what it was supposed to. It prevented her injuries and had her reach the pinnacle level as a, you know, an Olympic hopeful. So there are a lot of qualified strength and conditioning coaches out there that are doing the right thing. We're just, you know, again, stoning the path for them for best practices. And the other individuals who are the bad apples that are causing these problems are going to be compared to those expectations.
So I think we're going to go to like the last two questions. I think one is, I think to Jim, I think when you're describing, you know, these are things that you should know when you're talking about athlete care or senior care, when you're talking about emergency action plans. And I would emphasize even more. It's like not should, like you're required to know this. I've talked to a bunch of folks who've gone to these gross negligence cases, just like, how did you know how to do this? Where is the training? And it's just like, you are required to do this rather than just like, you should have an idea of how to do it. It's an expectation of the public. And I guess the backdrop of that is my kid just got into track and field in middle school. And it really kind of got me thinking about, you know, at middle schools or in particular high schools, when folks start to go and segment themselves into the athletic space. I know as a parent of two young girls, I want to know who the heck is training my kid beyond, and like how did you know how to do that? And I guess it's like, I know with US reps, Brian, if you want to talk a little bit about, we're pivoting to the high schools and looking in the kind of the high school kind of strength and conditioning professionals that are out there. What are your thoughts? Is that because you're a new dad too? So what are your thoughts on kind of like those professionals that training those high schoolers are out there?
Well, kind of to reiterate, and Jim can back me on this, is that there is parental expectations of the qualification. And I think once there is more information regarding the fact that these qualification standards exist and that they must be met, particularly under the regulatory space of the NCAA, that you are going to see more questions asked by parents of the athletic departments, because, you know, right now there's a little bit of ignorance that exists in, hey, I just expected the school to look out for my child's well-being. And as part of that is having the people who are in charge being appropriately qualified. When you find out that the person who was in charge is not qualified or has failures to support the student athlete safety, now there's going to be a major uproar. And one of the things that, Jim, you can talk to this real quick, is we know that there are consistent injuries and deaths that occur in high school that don't make the news. And so part of this is an amplification in getting that word out about the risks and the stratification of risk as it relates to the level of participation by your student athlete or club sport. Jim, you want to speak to that real quick?
Yeah, I think, Brian, that I mean, you make such great points here, but the expectation, the parental expectation is there. And I think it's even there more strongly now, understanding that, you know, medical experts and medical trained individuals like athletic trainers are not always available. And so people are asking more questions. I think, you know, it's one of the things that Marty McNair, Jordan McNair's father, talks a lot about is parental involvement being the number one issue around maintaining safety. And I think that's so critical. And I think that those questions are being asked and the expectations are there, regardless of level of competition and regardless of where the competition takes place. And I think that that just extends that, you know, circle of care that needs to go around an athlete when they're competing.
Fortunately, we're out of time and got to be cognizant of everyone's time here. There's two other questions related to scope of competency. If there's a document that's out there to help with that, especially for the exercise science departments, they're preparing students for the workforce. Something that's all those questions. There's like 2 or 3 questions that are left that we have. We can answer that through by email, and then we'll send the panel for that. But I want to thank you, our panelists, for your insights. This has been a great discussion, and look forward to talking into our next US Reps call that's coming up. All right, thank you so much. Take care.